Nebraska is set to be the first state in the country to roll out new Medicaid work requirements this week, following federal cuts to the program.
The country is watching Nebraska.
We sort of leveraged our eligibility resources and then also leveraged in-house IT solutions to build this.
Groups like Nebraska Appleseed are crying foul.
There are few chances for folks to provide really meaningful feedback because of this rush job. We're not having good processes in place. People are underinformed and uninformed.
There are 72,000 people between the ages of 19 and 64 covered under Medicaid expansion in the state. Of that, DHHS says about 25,000 would feel the effects.
This would be the population that we'd be sending a request. They'll have to demonstrate some flavor of work requirement or community engagement.
Families USA and Nebraska Appleseed say these new hurdles will harm patients and rural hospitals.
State and federal policymakers should be accountable for the decision to double down on the bureaucratic barriers and burdens that beset our healthcare system.
The results are going to trickle to everyone with Medicaid coverage.
You can find the full story at KATV.com.
Hello everyone, welcome back to Global Views with George, the place where we connect the dots they hope you never will. Now let me ask you something. How do you vote for a policy, celebrate it, and then act shocked when it shows up at your front door with consequences? Because right now, that's exactly what's happening in Nebraska. Yes, Nebraska, the deep red Nebraska, proudly MAGA, government is a problem. Nebraska is now watching its rural hospitals disappear faster than campaign promises after election season. And the reason, Medicaid cuts. Oh, you didn't think those cuts were real, did you? Now, let's talk about it.
Nebraska is probably really pissed that they voted for Trump now, because everybody that's like, no, Medicaid's not going to close clinics and Medicaid's not going to close hospitals. Ask Nebraska how one of their clinics is now being closed. Why, you might ask? Because of Medicaid cuts. Because of Medicaid cuts. And that's just the first to downfall publicly. Imagine all the small ones that's going to close without the public knowing. And yes, my face is greasy because I got on sunblock because I'm about to get outside. But listen, I'm trying to tell you, it is about to get real ugly in America. Y'all just wait and see all you nurses and CNAs and LPNs and doctors. Yeah, you might want to go look for a new job because you're about to get terminated. Thanks to Trump. Go thank your president.
Okay, listen up. We just learned of the first rural hospital shutting down as a direct result of Donald Trump and Republicans' bill. Check it out. And the headline tells the whole story. Rural Southwest Nebraska clinic closes, blaming expected Medicaid cuts. This article was published yesterday, by the way, before the bill had even passed. It's short. It just says a clinic in Southwest Nebraska announced that it's closing due to financial challenges, including anticipated Medicaid cuts. It's shutting down its clinic in Curtis, a town of about 900 people. The Curtis Medical Center has been in operation for more than 30 years, but Republicans, they just killed it like that. Their CEO said, unfortunately, the current financial environment driven by anticipated federal budget cuts to Medicaid has made it impossible for us to continue operating all of our services, many of which have faced significant financial challenges for years. The Nebraska Hospital Association, like all hospital associations, have been pushing back against Medicaid cuts in the One Big Beautiful Bill Act. But you know what? Those rich people just really needed their tax cuts, guys. And now, as we predicted, rural hospitals are going to pay, and they're going to pay big. And you know what? So will you and I. Of course, it's not just rural hospitals. Millions of Americans will now become uninsured. And the bill has, in general, put our nation on a new, more perilous fiscal path. Great. That's what you all voted for, right? You voted for jobs reports like these, interest rates like these, the US dollar plummeting. Just to recap, this bill is already shutting rural hospitals down. Poorest Americans are going to be dealt the biggest blow. Our economy is tanking and will tank more. And yet, some of you voted for Trump because of the economy. Hope you enjoy reaping what you sow. As for the rest of us, well, pray for us, because Donald Trump and the Republican Party have just thrown this nation under a bus, the likes of which we have never seen.
So, Nebraska can't catch a break, right? So it was reported earlier this year that it was quite possible that the state could go bankrupt, right? Because of the tariffs and the farmers not being able to sell their goods. Well, now it's being reported since the passage of that big bad bill that they're about to start closing rural hospitals. In one particular county, in Webster County in Nebraska, they are closing several rural hospitals, and it's going to impact about 3,000 people. But the saddest part of that is it's not only just the rural hospital, it's also the rural nursing home that's tied to those hospitals. So Mima and Pawpaw ain't gonna have nowhere to live. And again, this is another county that voted overwhelmingly for syphilitic SID. They anticipate that with the closure, they're not going to have hospitals. Nurses and doctors are already starting to quit so that they can go and find other work. So they're operating under a shortage while having to find places to put these people, in particular, the elderly that are in these nursing homes. Because a lot of folks don't realize it's a federal mandate. If I'm not mistaken, please feel free to correct me in the comments, but I believe most nursing homes have to have a certain number of beds to accommodate Medicaid patients. Because all of that is eligibility based on income. So therefore, if you are one of those low wage or low earners and didn't, make a lot of money and you didn't pay a lot into Social Security, you may have Medicare, but Medicare doesn't pay for nursing homes. At least not that I know of. If I'm wrong, I'm open to the correction. But I just, it's like we're literally only 6 months in, and it's been one breaking news alert after another since syphilitic SID took office. We've not had one day where there hasn't been some form of breaking news that hasn't been bad news. So I get it. All MAGA, all y'all heard was he was going to deport people and he was going to build alligator Alcatraz, and y'all thought y'all was going to buy tickets and eat popcorn to watch immigrants fight off alligators, fight each other. I don't know. Meanwhile, who about to go get Mima and Pawpaw when they don't have any place to live? Just something to think about.
So we're already seeing the effects of the bill, and it hasn't even passed yet when it comes to rural hospitals in anticipation to the Medicaid cuts. Curtis Medical Center in rural Nebraska has announced that it's going to be closing, and it does cite the anticipated cuts to Medicaid as one of the reasons they are closing. So this is only the beginning, folks. You can try to sugarcoat it all you want. This is what's going to happen.
You know what's really fucked up, right? Okay. Like, my credit isn't great now because it got messed up like 20 years ago when I first got really sick. And, like, I couldn't work. I couldn't do anything. Then I ended up having to go on disability. And, but, like, I haven't used credit at all in like 20 years. I just paid cash for everything, which I know I should build my credit up again, but I just didn't want to use credit. And so now I have to look for an apartment with like a not so great credit score. But like, it just sucks being freaking disabled and sick and not being able to work, and like, and I have enough money right now, but it's just, and I've been trying to figure out any kind of job that I can do, and it's down to I just don't know what I could possibly do at all, maybe, I don't know, maybe driving a little bit, delivering stuff, with my son, he could get out. But that's such a, I don't know, you're not gonna make much money and you're gonna ruin your car that way. And anything else is so painful. I can't even, I go to the store and if I'm looking at clothes, and just, going through the rack with your arm, and it gets so painful, I cannot do it. I have to get my son to go through the rack for me because my arms and my shoulders, everything, I'm so fucked up now. Every part of me is fucked up. And even my brain is really fucked up, the neurological stuff, the severe tremors in my hands and my feet now. I mean, I'm just really, really, really messed up. And I had to get all my teeth pulled out because they started rotting out because of the Bartonella and all the medicines they had me on. And so, and I have dentures, but I can't wear them. It's too painful. All the tissue in my mouth, your gums and stuff, it's painful all the time. Deep inside. I can't wear dentures at all. It sucks. So how do you can't have a public-facing job when no...
Medicaid is what keeps a lot of rural hospitals alive. We're talking about facilities that operate on razor-thin margin, serving aging populations, low-income families, and communities where private insurance isn't exactly overflowing. When Medicaid funding gets slashed, those hospitals don't just tighten their belts, they shut their doors. And now that's exactly what's happening. Hospitals are closing, services are being reduced, emergency rooms are disappearing. In some areas, people now have to drive hours just to get basic medical care. But hey, at least they earn the leaves, right? Now here's where the irony really hits. The same political movement that pushed for cutting big government spending is now facing the reality that, surprise, healthcare infrastructure in rural America depends on that funding. You can't cheer for less government and then panic when the services funded by that government vanishes. That's not how math works. That's not how policy works. That's not how reality works. And yet, here we are. Now, to be fair, not everyone in Nebraska saw this coming. A lot of voters were told these cuts would alienate, waste, or target others. You know how that goes. But policy doesn't work like a targeted missile. It's more like a wide net. And when it gets pulled back, it doesn't ask who you voted for before it hits you. So now you've got communities holding town halls, residents raising alarms, and local leaders scrambling to figure out how to keep essential services running. After supporting policies that made those services unsustainable in the first place, it's a political version of setting your house on fire and then blaming the smoke. And let's zoom out for a second. This isn't just another Nebraska about Nebraska. This is a preview. Rural communities across the United States rely heavily on Medicaid funding. When those funds shrink, the impact isn't theoretical, it's immediate and very real. We're talking about fewer doctors, fewer nurses, longer wait times, and in some cases, no care at all. So the big question becomes, what now? Do voters reassess the policies they support? Do leaders adjust course? Or does the cycle continue where the consequences are somehow always a surprise, even when they were clearly spelled out ahead of time? Because at some point, we've got to move past the idea that policy is just a talking point. It has real world effects. It determines whether hospitals stay open or close, whether people get treated or turned away. So, right now, Nebraska, those effects are impossible to ignore. So, that's where it comes to the point where I have to hear from you now. Do you think voters should be held accountable for the policies they support? Can rural healthcare survive without strong Medicaid funding? And do you believe situations like this will actually change how people vote, or will it be business as usual? Drop your thoughts in the comment section. Let's get the conversation going. If you found this breakdown helpful, please make sure you like, share, and subscribe to Global Views with George for more real takes and real talks. Next time, I'll see you on the next video. Please subscribe to the channel. Credit belongs to original creators.